So the best type of breast surgery for an individual is very complex, not an easy question to answer. There are many factors that go into what decision needs to be made for breast surgery. So basically, there's really two types of surgery: the lumpectomy or breast conserving surgery, or mastectomy, which removes the whole breast. That's the basic answer. Then we have to decide, do you have a gene mutation? If you have a BRCA gene mutation and you test positive, would it be in your best interest to do bilateral mastectomies? If you're not carrying the gene but have tremendous anxiety, and I see so many women making this choice when it really isn't evidence-based, they may choose that because you have to sleep at night, you know? So I tell a patient, your decision really, there is no wrong answer here. It's what makes you sleep best at night when all of this goes away and you're living the rest of your life. Have you made the right choice? But the pathology comes into play too. If there are patients who are triple negative, meaning they don't have estrogen, progesterone, or HER2/neu immunostaining, that's a more aggressive form of cancer. Would you be better served by a bigger surgery? Or would it be best not to have surgery at all, depending on the size of the tumor, and perhaps do neoadjuvant chemotherapy, or shrinking the tumor to ensure negative margins after surgery? So there's a lot to think about, and this is what confuses patients, and they get multiple opinions. They go online. The internet has great information, but it also has sketchy information, or chat rooms where people try to tell people what they've had done, which may or may not apply to you. So I think what my patients generally do is they get several surgical opinions, and then they come back to me and say, this is what I've been told. What do you think? It's a real tough spot. I'm a melanoma survivor, so what would I do if it was a different kind of cancer? I don't know unless I was there and it was my situation. So I try not to be the doctor who has to make a medical decision. But as a nurse practitioner, I certainly can speak to all the parameters of what would go into the decision making. And then at the end of the day, it's got to be the patient who drives the decision.